Hi, I'm Tyro Reichert, and I'm here today to talk about common knee injuries that can occur within track and field jumping events. I'm going to talk about these injuries, like what they are and what causes them, as well as like the symptoms and what you can do to treat them and even prevent them. Track and field can put a lot of stress on your body. The repetition of just jumping off the ground can really put a lot of stress on your knees. And if they're not properly rested, it can really add up. So the first injury that I'm going to go over today is called plica syndrome. What is a plica? The plica is a fold of synovial membrane located within the knee. Plica syndrome is just the inflammation of the plica. This can be caused by repetitive knee straightening and bending, or by twisting and jerking of the knee. So what are some of the symptoms that come with plica syndrome? Well, anteromedial knee pain will be visible and the plica will be very tender. You will be able to hear clicking or snapping as the knee moves. There will be pain in your knee if you're going up or down stairs. Studies show that a majority of people will benefit just from physiotherapy. The treatments that are given are aimed to reduce pain and inflammation, strengthen the knee, improve your proprioception, agility, and balance, improve the function of the lower limbs to be more efficient in walking, running, jumping, and minimize the chance for re-aggravating the plica. In order to help prevent plica syndrome, you want to keep a normal alignment within the knee. You want to keep your muscles in the knee joint and around the knee joint strong and flexible. It is also good to wear the right type of shoes that give you the most support. There are also knee braces that you can wear to help keep your knee in the proper alignment, which will reduce the chances of getting plica syndrome. Another common knee injury that happens in track and field jumping events is knee arthritis. The most common cause of knee arthritis is knee osteoarthritis. Knee osteoarthritis is a degeneration of the articular cartilage within the knee. It just wears down until the bone is more exposed. Some of the causes of knee arthritis that fall within jumping events can be affected by, if you had a previous knee injury, then it can cause for there to be uneven distribution of weight within the knee. Another cause for knee arthritis can be the repetition of compressing the knee joint. Puts a lot more pressure on the cartilage. Some of the symptoms of knee arthritis are knee pain, which gets worse with weight-bearing activities or going like up and down the stairs. The knee pain will also gradually get worse throughout the day. Also causes knee stiffness, also knee swelling. There's warmth around the knee. There'll also be clicking. And as for treatment for knee arthritis, there isn't anything to really make it better. It's more of just to help with the symptoms, because once the cartilage is gone, it's gone. So it's trying to slow it down as much as possible. So the treatment is aimed to reduce pain and swelling, normalize knee joint movement, strengthen the knee. Another way to help fight knee arthritis is with a knee brace. This will help alleviate some of the weight that is normally placed just on the articular cartilage. Another common knee injury that can be obtained by participating in track and field jumping events is bursitis knee. There are many bursae in the knee, but there's only one that really has a risk of getting injured in track and field jumping events. The infrapatellar bursa is the one that has the biggest risk of getting inflamed in track and field. So a bursa is a very thin sac that is filled with synovial fluid, which acts as a lubricating system for your body's joints. They're normally very thin, but they can become inflamed, and that is what is known as bursitis. Some of the symptoms are going to be swelling right on the patella. There's going to be a limited range of motion within the knee joint. There will be redness and warmth at the site of the bursa, and it will be painful for the knee joint to move. Treatment is aimed to reduce pain and swelling. It's very important to ice the knee, as well as therapeutic taping can be used. Strengthening the lower limb. Anti-inflammatories can also be used in addition to the treatment to help with the swelling and the pain. In order to help prevent bursitis knee, it is very important to make sure that you do enough stretching. It is also very important to make sure that you take plenty of recovery time. Another common knee injury that you can obtain from jumping events that is also related with bursitis knee is patellar tendonitis. This is also known as jumper's knee. Patellar tendonitis is going to be inflammation in the patellar tendon that is located right below from the kneecap down to the shin bone. Patellar tendonitis can be caused just by the repetition of the high impact of jumping or bounding across the track. In the early stages of this tendonitis in the knee, there will be pain as you're starting to warm up. As the knee gets warmed up, the pain will go away. As the tendonitis gets worse though, this will not be the case. In treating this tendonitis in the knee, it is very important to ice for 20 minutes, 2 to 3 times a day. This will help reduce the pain and the swelling. Anti-inflammatories will also benefit in reducing pain and swelling, as well as exercise to stretch and strengthen the knee joint.